The next patient is a Dutch Shepherd, male, 2 years old. Initial veterinary inspection suspected a back problem but failed to cure the condition. Nero was then presented as an emergency to a clinic, who suggested a potential elbow pathology. However, this was not supported by X-rays, so it remained a suspicion. Nero was presented for a functional orthopedic examination at Dr. Blattler-Monier's practice. There, an elbow pathology could be proven. Moderate muscle atrophy of the left supraspinatus muscle was found, as well as limitation of extension and flexion of the left shoulder. In addition, the elbow joint showed slight warming, while the range of motion in the elbow, especially pro and supination, was reduced. The back was stiff and the thoracic and lumbar spine were hypermobile. The subsequent sonography of the biceps tendon clearly showed that its bursa was very filled, which is why Nero was sedated for a CT study of the shoulder limbs to be certain. This clearly excluded an elbow dysplasia. Therapeutically, a tenotomy of the biceps tendon was then performed, and after 6 weeks a control sonography, which revealed a severed tendon but also the healing of the bursitis. The functional movement measurement with the LupoGait system showed a reduction in the stance phase of the left shoulder limb, but a slight prolongation of the slope phase and an equally slight increase in the vertical acceleration. These findings of the stance and swing phases as well as the PVF represent a clear sign of relief and are also considered evidence that the restoration of functionality of the left shoulder has not yet been fully achieved. No lameness is seen in the video sequence and the movement presents as normal. However, on closer inspection it is noticeable that the left shoulder limb is not fully spatially extensive, and the load is reduced compared to the right shoulder limb. Follow-up therapy continues to be monitored with the LupoGait system. The consequence of the still present disorder would be a physiotherapeutic treatment as well as an ACS therapy with autologous conditioned serum, the success of which can be monitored in an evidence-based manner before and after the injection with the movement measurement of the LupoGait system.